Let me tell you about the American system and how fucked up it is. I'm not trying to cry on this fucking internet, but this is the reality of living in America. So my daughter is medically special needs. She sees specialists. She's constantly in the hospital. And because I got a 3% raise at work, they're canceling her state insurance. So now I have to figure out how to pay for these specialists and hospital bills. And then on top of that, they've canceled her child care voucher. So now on top of that, we have to figure out how to pay $300 a week for my child to go to child care so me and my husband can work. And no, I'm not saying it's the government's responsibility to take care of my child. I decided to have her. But I also didn't get to choose for my child to be medically complex. And I work every day to pay into this system and reap no benefits from it. Welcome to fucking America.
So most people are actually just sharing what the medical system is and how expensive it is to actually get any healthcare. And people are not necessarily saying that it should be free. It's more of them saying that it's just too expensive. I know there are a lot of countries where you go to, once you're getting any, healthcare, you're definitely gonna pay for it. But in most places it is like cheaper and more in a reasonable price. But in this country, the reason why most people are ranting is because it's so expensive that it's making people be in a lot of debt and almost unaffordable for them to get treatment, and especially those with serious health issues who consistently need to go to the hospital. So we're just going to be checking out this rant. This is the part 2, and let's get right into it.
You know what? I really feel like the American health system is showing their ass lately. Not only are these doctors coming out and literally saying, no, you're black woman, you're right. We are treating you as if you're exaggerating and not treating you correctly because our own stereotypes and thoughts. But I'm also currently in the middle of my own situation with a hospital. I have no insurance. I'm 25. I can't afford insurance. So I was, kind of stuck in a rut because I was sick. So sick, like literally throwing up for 5 days, throwing up green. And I was like, you know what? Instead of dying, let me just double check in case something's wrong. So I went to the hospital emergency, a couple hours. It wasn't even a night stay. I received 4 bills so far. $886, $662, $126. And then they just hit me with another bill. That's $2,349.90. I call them. And I'm like, hey, I just paid $862 and $662 and another $129. Why do I have still a balance of $2,349? It doesn't make any sense. Who am I paying? What am I paying for? Because here it says the medication is $459. When in the script that I paid previously, it's saying the medication was $60. You know what they told me? They told me that the first bill, the $800 something dollars, and then the $600 something dollars, and the $129 was paying the people who gave me the treatment. The $2,300 is the cost of the treatment. So they're saying the same medicine they gave me in the hospital, the $600, that then they gave me a subscription for, that I got in the hospital for $15, is the same bill they're charging me now. That adds up to the $2,300, and that's not for the service. I'm not paying people for that. I'm paying for fake medication numbers that are that. I'm sick of it. Then I was like, you know what? Let me try to get extra financial aid. Fuck it. Why not? I call. First of all, they're giving me attitude, as if it's not normal for a fucking average American to not have this money to pay on a medical bill out of the blue. They're mad at me. Babe, I don't work. I don't do the economy. I don't control it. All I can tell you is I'm not the only one. That's all I can say. Anyways, trying to get financial assistance. More of it. She's like, they already took, okay, keep in mind, the actual number that they bill insurances, it says 16,000 something. They took away $14,000. So you're telling me it's imaginary. You can take away this money. Anyways, not the point. Apparently, not the point. She tells me with an attitude, we already took away like $14,000. That's great for you guys, but it doesn't matter how much you take away, I still don't have it. It doesn't matter. You can take away more because clearly the numbers are just made up. Fucking take away more. I don't have it. She's like, get on a payment plan. I'm like, I would love to, but it would still be really expensive for me as I'm only 25 and I pay all my bills with no help. So no, I can't just hop on a payment plan. Thanks though. Anyways, I was like, can you have something a little more helpful? She's like, okay, sure. Go to Medi-Cal, apply for them, get denied by them, then call us back. So then we can offer you financial assistance that you then send back. So then you can maybe get approved and then get your bill reduced just a little bit more. I was like, you understand that makes no fucking sense, right? I'm already telling you I don't qualify. I make too much for Medi-Cal, but I'm too rich for the other thing. So, again, average American, stuck in the middle. So I was like, you do know it makes no sense for me to already tell you I don't qualify, but then to go out of my way to not qualify, work with those people and do all of those calls, then to call you back for you to then send me something that I wait on, for then me to send it back. It doesn't make sense. Just take the money off. I'm already telling you I cannot afford it. It's not getting paid. I'm already, listen, something needs to change. Because you pay health insurance too much. You pay health insurance just to then pay copay, to then pay on that copay when you get a bill anyways. You then don't get health insurance. I pay literally $8,000 as a tax penalty for not having insurance. So I pay $8,000 there. To then pay another $6,000 when I do need accidental emergency care. So next time I'll just choose death. Death sounds a little bit cheaper. I'll still have to pay for the coffin or the cremation, but you know what? It's gonna be a little cheaper than actually maybe getting seen to be alive. So next time I know what to do. It's fucking ridiculous.
Sometimes I wonder if these hospitals, do they really sit down and actually kind of calculate and think about the bill that they send? Because I'll be like, wait, this is so unimaginable, the prices. Like, how did you even come up with that? Because it just feels like they're just throwing numbers out there. They could just send you a bill and say, hey, this bill is 20K, this is 30K, this is 10K, and it's like, wait, like, are you guys even calculating it and thinking about it? How do you even come up with saying just a person even visiting the doctor, it's that expensive? I just don't understand it.
Does anyone else feel like they just need an extra $1,000 sometimes? Specifically for going to the doctor. I just need $1,000 to go check out a couple of small issues that I'm experiencing with my body or have questions about. But every time I step foot in that door, it's $50 at least. And now I don't even have an insurance because I'm unemployed. So no insurance, no money to pay for this. And I just want to go and ask questions about, hey, I, had this little thing in my ear, something going on with my whatever. And it's not like I'm having a heart attack here, but I want to go to the doctor and make sure I'm okay. And I can't even afford it. So I need an extra, even $500 would help. Jeez.
Hi, therapist here. I thought I would actually chime in because I recently made a video about how I owed $11,000 for my premium healthcare tax credit because I made too much money last year and the government decided that they gave me too much to help me pay for healthcare insurance and I have to pay them $11,000 back. But I wanted to share something with you that I think is very important for people that are looking for healthcare insurance or decide not to get it. Here's what you need to know. As a therapist, I have contracts with health insurance companies. I don't actually set the rate. The contract that they have with the company, they set the rate. So what does this mean? For instance, if I have one health insurance company and they tell me that I will make $160 an hour, what does that mean? If you are someone that holds that health insurance, that means that if you have a deductible, I have to charge you $160. Now, here's the thing that I like to tell my clients is that sometimes paying self-pay is cheaper. My self-pay rate is cheaper than the health insurance contract. Now, when you do this, even if you have a deductible, sometimes you also have an out-of-network deductible. So if you are paying me as self-pay, you can actually apply that to your out-of-network deductible. And also, too, you might want to check with your health insurance company because even if you pay me self-pay, you may even be able to apply that to your in-network deductible. Or honestly, if you pay self-pay, you don't have a mental health record. So when you try to apply for disability insurance, it doesn't exist because you pay self-pay. I also wanted to let you know, sometimes it's actually cheaper to not have health insurance. When me and my husband moved from Minnesota to Arizona, we were looking for health insurance and we didn't have it. My husband ended up going to the ER. Do you know that him going to the ER was actually cheaper than when we didn't have insurance? Because they went by our income, they actually wrote off quite a chunk of it. Now, here's the thing. I had health insurance when I got into a car accident. My bill for getting into a car accident when I had health insurance was higher than my husband's bill for going to the ER when we didn't have health insurance. Mathing.
I found out on Monday that during my evacuation, I actually lost my health insurance, which means I can't pay for any of my medication or any of my medical appointments. And I just found out that I'm allergic to bees and apparently wasps. And I have to get an EpiPen, but I can't afford an EpiPen because it costs $750 without insurance. I also am supposed to see the doctor, the retina specialist, to get scans on my eyeball because there's a nevus, a mole, on the back of my eye that they think might be cancer, but I can't get it scanned to make sure that it's not. I literally can't afford my emergency inhaler, and my cat just got put into the emergency animal hospital because I woke up this morning and he's super lethargic. And he won't eat, and he's not super responsive, and he has kidney disease, and he's 18 years old, and I've had him since I was a kid. And the quote that I got from the emergency hospital is, just for basic treatment before they even know what's going on with him, is $915. And in order to afford my medical care, I need at least another $1,000. You could just share my shop or just donate any bit that you can. That would be really great, because I don't know what else to do. And I really need an EpiPen, and I really need my inhaler, and I really need my cat. Anyways, I thank you. I love all of you. I'll keep you updated on the situation.
When you're trying to go and get, some medications to go to the doctor, you know what is wrong with you, but you need to go and sit down for the doctor to actually tell you, hey, yeah, he will repeat the same thing that you said to him that is wrong with you, and then tell you, okay, I'm going to give you a prescription, and then you're going to give it to the pharmacy, and they'll give you the pill. I'm like, in other countries, you just go to a pharmacy and you get that pill. But what they want is just money. So they can tell you, the doctor will just repeat the same thing to you like a goddamn echo. And then you go. Some normal pills that should be in the hospital, high blood pressure pills, should be there in the pharmacy. But they don't even have that. You have to go to a doctor to tell you that. So everything, I feel like in every way, they're just trying to get the most out of you, get a lot of money out of you. To me, like I said, some people who actually care about having a perfect credit score, they are the ones who actually have heart attack or high blood pressure, have sleepless nights in order to pay this bill.
All right, I had to step out of the office because we have some time-sensitive info to discuss. You'll remember this video. This is the first video that I did to introduce you guys to the hospital pricing transparency law. This law required hospitals to post their actual prices for their services online so the public could see them. It was also eventually supposed to make insurance companies post their prices for services as well. We have been fighting nonstop for the enforcement of this law, and finally they started to issue fines to hospitals who were not complying. But now CMS, the people who enforce this law, are now proposing new amendments that could water down this law significantly. Today is the last day that they're allowing the public to submit a comment to them about these new amendments. I want you to go comment, but first let me tell you about some of the issues that I have with these new amendments. Number one, it seems like they are giving hospitals more leniency when it comes to giving out estimates. As somebody who spent all last year negotiating medical bills, I can tell you estimates are not good enough. Hospitals have dodged a lot of accountability by using these price estimator tools. When a hospital charges way more than what they have listed online, they kind of just get to shrug their shoulders and say, well, it was just an estimate, it doesn't have to be accurate. Another amendment they're proposing is to allow hospitals to put these prices into files that are not consumer friendly or even readable by humans. Having prices listed in a format that aren't even decipherable defeats the whole purpose. And last, they are proposing that hospital administrators have to sign an acknowledgement saying that they are in compliance with the federal law. I'm cool with that, but having a signature without enforcement means nothing. So they also should add to these amendments that if hospital administrators are signing that they are compliant with pricing transparency, there needs to be a direct monetary consequence if that signature is not valid and they are not compliant. So please go submit a comment about these new rules. The first link in my profile takes you to a page that looks like this. There are some talking points written in there in case you need help knowing what to say, but feel free to delete that and tell your own story. Comments are closing at 5 p.m. Eastern time, so go do it now.
So I'm a little fired up this morning. This is going to be a little bit of a rambling rant. I saw a TikTok video yesterday by a woman talking about her own frustration with medical debt. Her husband got a diagnosis of pancreatic cancer, wasn't able to get any Social Security benefits, and they burned through their savings and went into debt for his care. And she is now saddled with hundreds of thousands of dollars in medical debt, and she's lost her husband. Now, this is something that I think everybody should look up. Just get on the Google machine and Google medical debt. And what you will find is that this is a unique problem to America. In fact, the number one reason for Americans to file bankruptcy is medical debt. I'm going to say that again. The number one reason for Americans to file bankruptcy is medical debt. And out of 33 industrialized nations, 32 of them have universal health care, and in all 32 of those industrialized nations, medical debt is not a thing. No one loses their savings or their retirement or their homes to medical bills. Medical bills actually affect people who work in healthcare. So I've gotten messages from nurses and medical assistants and physical therapists and doctors who have experienced medical complications and medical bills and problems paying their medical bills. Even I, as a physician, have had a problem with this. I used to work for a federally qualified health center. I did not make very much money. In fact, I did not make enough money to cover the interest on my student loans, which is part of the reason why I left. But a significant factor in that was while I was working for that clinic, I got acute appendicitis and ended up in the emergency department. I knew all the nurses that took care of me in the ER and in the OR. I knew the surgeon personally who took out my appendix. And we got a medical bill for $4,000, which we could not afford to pay in one lump sum. So what did we do? We arranged a payment plan. And immediately after making the first payment on that bill on time, I was sent to collections. A doctor who worked in a city and knew the entire staff of the hospital was sent to collections for a medical bill that he had actually paid on time according to a payment plan prearranged. That is our healthcare system. It is completely broken. Universal healthcare should be a thing in this country. And if you aren't voting for it, you are voting against your own self-interest, and it will eventually get you too.
If I could win the lottery today, with how I see the whole healthcare is, if I do win the lottery, someday I make a lot of money and I'm rich, I am definitely, the first thing I would do is own a hospital in America. Because tell me, like, what other way is the best way to become rich? Super, super rich. Tell me. Hire a bunch of doctors, hire a bunch of nurses, have them in my big hospital doing all the work for me. Period.
So the way Americans pay for healthcare is so weird, it's almost like mathematically stupid. Let's break down why. So part of being human, right, is that something horrible could happen to you at any moment. You're walking down the street, you're hit by a Land Rover, you get cancer from the power lines above your house, it's Daniel Mack surprises you at an intersection, you have a heart attack, whatever it is, okay? You have to go to the hospital, and you got to get that problem fixed, and it could be extremely expensive to do so. More money than anyone could reasonably be expected to have. That means that each of us is incurring this enormous amount of risk, both medical and financial, just by walking around living. So how do we reduce that risk? Well, in a lot of countries, what they do is they pool everyone's money together via a system called taxes. And then when something bad happens to any particular person, that big pool pays for it. But because there are so many people in the pool, the cost to each individual is quite low and everyone is covered. In America, we do not do that. Instead, we have these smaller, private pools called insurance companies that you have to pay to get into. Now, there's two problems with this. One is, because the pool is so much smaller, they can't spread the risk around as far, which means they have to jack the prices up for everybody to compensate. That's why our healthcare costs so much more. So expensive that a lot of people can't afford to buy into it at all, leaving them completely uncovered and exposed to all that risk. But second, even if you're lucky enough to have coverage in this country, the fact that our system is run by for-profit businesses means that those companies are incentivized to try to avoid paying for your medical procedure, even if it's covered. And when that happens, you get stuck with the bill. So just to review, we pay more for worse coverage that covers less people. And the result of this is that in the US, we have skyrocketing rates of medical debt. Around 1 in 5 Americans has medical debt. In fact, a quarter of all of our credit card debt is actually medical debt. It's just people putting hospital bills on their Amex. 2/3 of all bankruptcies in this country are because of medical debt, something that's just impossible in other countries. So the way we pay for healthcare is hurting people's health and ruining their financial lives. It's very clear that we need a brand new system. We have to build it from the ground up. And that's taking a while. But as we continue that fight, there are still people that are working to solve the issue in other ways. On my podcast, Factually, I just interviewed a woman from an incredible organization called RIP Medical Debt. Check this out.
So you give us $100 and we get rid of $10,000 of medical debt. We have a 1 to 100 ratio of return on investment. The letters we receive back from people are like, the amount of mental anguish that they clearly are being relieved from is significant.
I mean, how cool is that? They use our donations to abolish other people's medical debt, freeing them from it forever. To learn more about them and to learn more about the case for single-payer healthcare, check out my podcast, Factually, available wherever you get your podcasts.
I am paying all of my bills right now, and it's a good stack. I get to the Boston Children's one, and the Boston Children's is our biggest bill right now, and it is about $1,200 something. I'm very fortunate. You know, it could be a lot worse than that, but it's $1,200 something. So I get on to pay it, and then it says, oh, this is not up to date, and you actually owe $5,200. And I'm just like, whoa, but it's not telling me what's it for. Try to make an account to get access to see what I'm actually getting billed for. I don't have access to it. So then I'm looking at the bill that I have actually in hand, and it says self-pay. And I'm just like, wait a minute. I have insurance. We were never self-paying. And so I have to do the lovely thing and call. And luckily, I didn't have to wait that long, which is great. I tell her that I have this bill and I have questions. I give Natalie's information, my information, and she tells me I don't have insurance on file. I'm like, yep, that's why I'm calling. I give her the information for insurance, and then she's like, okay, I'm just waiting for it to process. And I'm just like, well, that's a problem because she is deceased, and so she's not covered right now. And so it's going to come up that she's not covered because she's deceased. But she was very much alive when this consult happened. It was a 10-minute meeting. A 10-minute meeting? We owe $5,200? What? So then as soon as I said she's deceased, the lady goes, she died on the 13th? So I'm like, no, she died on the 12th. And then she was like, okay, well, you won't be getting a bill. And I'm just like, what do you mean I won't be getting a bill? She's like, you won't be getting a bill. We will not be charging you. We will not be sending you a bill. And I'm just like, so what do I do with the one in my hand? And she was like, throw it out. What I will do. So I guess because my child died, I don't owe anything, which is great and morbid and fucked up.
Can someone please explain to me why I'm still getting medical bills even 9 months after I stopped going to doctors who took insurance? I had really good insurance. I always paid when I went there, and I've just like, it's constantly just so many medical bills that come after the fact, months later. I truly don't get it. What have we been paying for? Like, what? Can I get one bill and just so I can pay it and just be done with this? This is so frustrating.
I don't usually get like political on here or rant about like the current state of the economy or anything like that because it's just a whole can of worms I don't want to open up. But I had an endoscopy last December, like over 6 months ago at this point, because I have gastritis. And I paid my upfront deposit for the procedure and everything. And every month since then, I've received bills in the mail, and I had met my deductible for my insurance at the end of last year. So why am I still paying for this? And the most ridiculous thing, so my husband had cancer last year, and tax season this year, we were adding up everything that we paid so that we could take it out of our taxes. And for all of his chemo treatments and everything, it was $500,000. $500,000. We had to pay probably about $10,000 of that out of pocket, which is a shit ton. And he's still getting bills in the mail for it now. And I don't understand that either. We have good insurance. He works for a good company, and we have like a good insurance plan. So why does it cost me like $181 to get lab work done that should be covered by my insurance? I just don't understand, and it makes me so mad. Medical bills are one of the things that make me so mad. My cat is mad with me. So yeah, insurance is a scam.
I'm sure it is very painful, and it is so sad for many people who are actually going through like some chronic illness, who consistently have to go to the hospital. I feel like they are making it it's almost like they are so ready to just see you go pass away, because if you're charging this type of huge amount of money, what do you want people to do who consistently need hospital, who need treatment all the time because they are not feeling well? And it is either a situation of life or death for them. Like their family cannot, even if their family try to put money together, they cannot even pay it. So it's very, very it's a sad situation. I wish it could be different, but it's just the world we live in. And for those people who can actually go to other countries and get treated, like that is better for you. Healthcare is really extremely cheaper than it is here. Thank you all for watching this video to the end. I really appreciate you. Don't forget to click the like button, please. That really helps with the algorithm. That is the thing I'm asking you to help me do right now. It's really something that I appreciate a lot. It lets me know that you really love my video. And also leave your thoughts in the comment section. It's greatly appreciated. And subscribe to the channel if you love my content. I'll see you on the next video. Bye.